speaker I'd like to introduce is Tracey Lambert. She's the Regional Head of Health for the Public Sector UNISON. So please give it up for Tracey.
First of all, can I congratulate Mark and his team for organising the event tonight. I think it's fantastic that we've got such an array of speakers talking about austerity and the attacks on the public sector. And they do say, don't they, that what goes around comes around. And the last time I spoke with Tony Benn was in the 1980s when we were on a platform talking about the Tory cuts on the NHS. And here I am, a few more grey hairs 30 years later, talking about the Tory cuts on the NHS. And I think the one thing that we can say is that the NHS is not safe in the hands of the Tory government. And whatever Cameron said during the election campaign 2 years ago, he would cut the deficit, not the NHS, has proven to be a lie. Many of us wondered if any health secretary could actually be worse than Andrew Lansley. And then I woke up one morning to find out, and I think Jeremy Hunt was equally as surprised, to find out that Jeremy Hunt had been made the Secretary of State for Health. Rupert Murdoch's errand boy, who has signed up plans to scrap the NHS. He wrote a chapter in a book arguing that the NHS should be denationalised. He also came out at the weekend attacking a woman's right to choose, demanding that women's abortions should be limited to 12 weeks. A very clever ploy, because all over the weekend that took up the health story for the weekend, when elsewhere we were hearing about Manchester hospitals being threatened with closures, 6,000 job losses, nurses and midwives job losses. That was a very cute move that he made. That was planned, that announcement on Saturday morning. He takes over as the NHS faces a three-way crisis, with each of the problems worsened by this Tory coalition government. And let's not forget the Lib Dems' part in what is happening in the NHS. We're at the end of 10 years of growing budgets, with a freeze on NHS spending until at least 2014, meaning a falling resources in real terms. £20 billion worth of cuts, and even the Chief Executive of the NHS says it's unachievable.
How much has it gone up by 20 in the last 20 years?
Much of it in the form of holding down pay. Our members in the health service, 1 million health workers, have not had a pay rise in 2 years, not expected to have one in the next 2 years. Within our region, the east of England, 9,000 whole-time equivalent jobs are set to go within the next 4 years, and that's across the board: doctors, nurses, professionals, 9,000 whole-time equivalents. And while staff bear the brunt of savings, patients are also facing costs as more and more services cease to be available through the NHS. In South West Essex, 200 treatments previously available on the NHS have been stopped. And unfortunately, the previous Labour government set up the bridge to privatisation, and the Tories have walked across it. The impact of many NHS and foundation trusts of expensive and increasingly unaffordable PFI, originally established by the previous government, are hitting our hospitals. Many of them were negotiated in the early 2000s when budgets were rising, and the Department of Health allowed payments to be made to improve PFI. However, now that hospital budgets are frozen and falling, PCTs and GP commissioners are trying to send fewer patients to hospitals. And in South West London, one trust with 2 PFI hospitals have already been taken into administration. And there are several more on the brink of a similar crisis, including one in our own region at Peterborough and Stamford, where a so-called turnaround team have been brought in to try and alleviate their £54 million debt. Now Jeremy Hunt has signed even more PFI deals and are clearly determined to keep PFI intact. And finally, we have the chaos, fragmentation and bureaucracy flowing from Andrew Lansley Health and Social Care Act, which only just scraped through the House of Lords. 400 pages, bigger than the original act that Aneurin Bevan put before Parliament to set up the NHS. The act has no electoral mandate, was opposed by the public in opinion polls, and opposed by every section of health workers, including GPs, who were supposedly being one of the gainers under the act. Far from being put in charge, more and more GPs are realising the extent to which this brave new NHS will actually take budgets away from them and will be controlled miles away by the new NHS Commissioning Board, accountable to nobody. The Act is seen as a bonanza by the private sector, with Virgin and Circle hoovering up new contracts, including child health, mental health, and in Suffolk, the whole of the community services was taken over by Serco last week. This is a company that tried to deliver out-of-hours treatment in Cornwall with just one doctor on duty to cover the entire county, and then lied about it, not just once, not twice, but over 36 times when they submitted their accounts. This month, at least 3 sections of community health provision in each area have to be handed over to the so-called any qualified provider. Anyone in this room can set themselves up as an any qualified provider. This will open up further private companies to pick and choose services which they find profitable while existing NHS services are destabilised. This gives GP commissioners the least control over the quality of services. With competitive tendering, the clinical commissioning groups would at least have the opportunity to examine the credentials of the companies. They won't have that. Q, Del Boy and Rodney, or Hip Hip Hooray Limited joint replacements while you wait. Once a company is on the approved list and regarded as qualified, they can demand to be included among the options which GPs offers to patients, with the patients left, apparently, to choose between them. And if GPs refuse to allocate care and services to these any qualified providers, these companies can invoke competition law in much the same way as Richard Branson did when they lost the contract for the West Coast Line. There seems to be no mechanism to get a company removed from the list or enable services to be brought back into public ownership. And another worrying aspect which seems to have slipped people by is the capping of private provision within the NHS. Used to be between 6 and 7%. This is the income that trusts can make from private patients. This has been lifted to 49%. This means that for some prestigious teaching and specialist hospitals, receiving fewer NHS-funded patients and getting less money for each treatment have every incentive to go out and seek private customers from home or abroad. And Adam Brooks Hospital, world-renowned teaching hospital in this region, have just started the plans and laid the foundations for a new luxury hotel where you can bet your life they haven't done that for you and me going there. That is so that they can bring in private people from abroad to use their NHS services. It doesn't take a genius to work out who will be the priority for the trust bosses. The dwindling numbers of NHS patients on fixed and reducing tariffs will become second-class citizens in where NHS hospitals, while the red carpet is rolled out for wealthy paying customers. In other words, the Lansley Act is a far-reaching fundamental attack on the very fabric of our NHS. It scraps accountability and local control, puts cowboy businesses and private multinationals in the driving seat on dividing up services, and leaves a dwindling rump of the public sector to pick up the bits the private sector doesn't want: the emergencies, the complex cases, the risky cases, nearly all mental health, and most actual care of the frail and elderly. The Act kicks in next April, but this government have been gung-ho and want it implemented by the end of the year. That's why we as campaigners have to step up the effort to ensure that every attack and erosion of local services is identified and challenged. One way to do this would be through a local Cuts Watch organisation to link up with local health unions, pensioners groups, community organisations. We need to collect evidence of changes and their effects on patients and make sure these are fully reported. I don't buy this newspaper, although my mum tries to get me to buy it for her, the Daily Mail. I was reading that today because they're actually attacking the government about cuts and closures of A&Es. Now, if the Daily Mail can do it, I think it really seriously shows the problems that we have. Calvin was saying the NHS was born out of austerity. It was built by workers, for workers, and paid for by workers. And this government, it doesn't belong to this government, and colleagues, they are stealing it from us from right under our noses. If the Act is implemented as Lansley and Hunt intend, there will be little scope for whoever is the Secretary of State in the Labour government to reverse it. We need to fight now, fight hard, and fight together to keep our NHS and keep it public. And we can start all of you can turn up on October the 20th, because as well as fighting the austerity and job losses, we need to go to London on October the 20th to show this government that the NHS belongs to us, not to them, and we need to fight to keep it public. Thank you.
So Tracey, if Jeremy Hunt and Andrew Lansley were both drowning and you could only save one, would you eat dinner or would you read the paper?
I think it probably well, it's difficult because I'm a registered general nurse, so I have an obligation to go and save them. I think I might have to look the other way.
Okay, yeah, that's fine, that's fine. All right, next up.